Taking a calcium supplement, it's okay. Calcium is approved by the U.S. FDA for the prevention of osteoporosis. But the reality is, when it comes to osteoporosis, and what I try and get across to people is understanding the difference between osteoporosis and how is it diagnosed, and that is a bone density scan, and what is the risk for fracture, because that's the real dangerous part of this disease, is fracturing a bone. As I mentioned before, if you break a hip and you have osteoporosis, there's a 20% chance you're going to die in a year, and of those patients who survive that first year, 20% of them will end up in a nursing home for chronic care with chronic debilitating pain, and the risk for actually mortality or death after one of those hip fractures is increased for up to 10 years after. So it is a deadly disease. The biggest risk of the disease is not somebody's bone density scan, and not the T-score or the results of a bone density scan. It's what is the fracture risk. And dating back all the way to 1996 in the published literature, we see studies appearing, there are many of them, concluding that the ability for a bone density scan to predict a fracture in women is only 44%, and in men it's only 21%. All of the major medical organizations now, American College of Obstetricians and Gynecologists and others, the position statements are very clear on this. Their position statements are that fracture risk is dependent on factors other than bone density scans. And I slow down when I say that because I want people to really understand, and this is what I take a lot of time in my clinic talking to patients about, is educating them of the predictive value, the benefits of the bone density scan, but also its limitations. That we've got to look beyond bone mineral density at bone quality, that is the collagen, the connective tissue in the bone, to really understand how we can devise strategies to reduce fractures and fracture risk as much as possible, and that's where the MK4 comes in. Because the MK4 at 45 milligrams a day, it's a form of vitamin K2 in Osteo-K with the calcium and the vitamin D, has actually been shown to decrease fractures by 87% in clinical trials, and that surpasses any of the medications on the market. Now, it's not a medication, it's a dietary supplement, and it's available to anyone through the website, over the counter, and it can be taken with the osteoporosis medications if people want to continue taking those.
So let's say there's a patient who doesn't have osteoporosis yet, or maybe even doesn't have osteomalacia. Maybe just knows they have like a very, very strong family history. Maybe they're getting to be that age of menopause. Should they take it preventatively, or should it be something once they already had this setting in?
They absolutely should take it preventatively. They absolutely.